Have you ever taken a pill, taken an injection, and wondered, I wonder how this medication is actually doing its job? I doubt it. Most people don't take their medication and then think to themselves, I wonder if it's working, or I wonder how it works. But I would subscribe to you that that's something that we all need to be thinking about, because you might be doing something that is interfering with your medication even doing its job, or it might be making your medication do more than it needs to do, which could lead to issues on either side of the spectrum. So my name is Dr. Takova Wallace-Gay. I am the community's pharmacist, and I'm very passionate about medication and medication education because many people, including my dad's life, was changed by medications that he did not fully understand. And back then, I didn't fully understand it either. And so I've created this platform and I've created my framework, which is the Bridge to Better Meds framework, in order to help people go from confusion to clarity, from overwhelm to empowerment when it comes to medications. And because it is National Pharmacist Month in October, I want to start this month with the very beginning of everything, which is how medications can work in your body, which starts with absorption. If we don't get this step right, then the rest of everything else really doesn't matter if you can't get the drug in your body where it needs to go to do its job. So we're going to talk about absorption in this video. And then the videos after this will go through some of the other things that happen after step one, which is absorption. So if you take a medication and it can't get into your bloodstream, or it can't get into your brain, or wherever it's supposed to work, then of course you're not going to get the benefits from that medication. So just to kind of back it up and talk about what absorption is. Absorption is specifically how a drug moves through your body, from entry point into your bloodstream or into the site of action where we want it to work. And it's kind of like fueling up your car. If you go to put gas in your car, but there's something blocking it and the gas can't get in or can't get to your engine, then nothing's going to happen. The car's not going to work. There are several different routes of administrations for medications. The first one that most people know about is oral. So taking something by mouth, that's the most common one. It's also the main one that's going to be affected by food. And so when you think about that, first of all, you've got things in your saliva, things in your mouth that are already going to interfere with that med as soon as you take it. Then as it goes down and travels into your gut, food may affect it. There are some medications where we recommend that you take it with food, and you've probably seen that before, because that food is going to stimulate stomach acid, and that stomach acid may help that medication dissolve or work better, depending on, what the medication is. There are other medications that we tell you not to take with food, because if you do, those same effects of the food could diminish the medication and cause it not to do its job at all. There are what we call enzymes, chemicals in the body that break down some of the medications. And so some of the enzymes in your gut may be affecting and breaking down the medication too quickly, or turning it into a different form that we don't want it to be turned into as quickly. And then I'll go back to food a little bit, because there are some specific medications that not only do you need to take it with food, but you need to take it with a high fatty meal or a moderately fatty meal. And so they're very specific in that it needs that fat in order to be absorbed properly. And so these things all have to do with how the medication is chemically created. And all of those things matter for how the drug gets into your body. So that's oral. You can also take it sublingually or buccally, which means sublingually under the tongue, or buccally between the cheek and the gum line. And this is going to avoid something that we call first pass metabolism, and I'll talk about that in a minute. This allows medication to just quickly absorb right into your system from underneath the tongue or through the buccal process. And so these are medications like sublingual nitroglycerin. There are others out there that can be taken by mouth. There are some medications that of, like we just chew them, which helps a lot of that dissolve in the mouth as well. And so that's still considered oral, but we specifically refer to those as either sublingual or buccal. All right. And then we have medications that are inhaled. And so these are going to act really quickly, but obviously most inhaled medications are things that we want to get to the lungs pretty quickly. And so you inhale it, It goes straight into the lungs. It's able to do its job. However, there is a way that you need to inhale it. And so we'll go through, when we're talking with patients, we'll go through counseling points on how to make sure that you're inhaling properly so that those particles can actually get into your system and into your lungs, and that you're not, swallowing the medication instead of it actually going into your lungs. So inhalation, a lot of medications can be taken that way, nasally, or they can be inhaled orally. And so we've got inhalers for asthma, for example, that can be taken by mouth, where you press the plunger or press the button, and then you breathe in, and then that medication goes straight to the lungs. So inhalation can be nasally or it can be orally. 9 times out of 10, we're using that for either local nasal congestion or something for the lungs, or we're using it, as an inhaler directly for the lungs for things like asthma or COPD. Okay, and then we've got topical, and this can be mostly transdermal. So this is like our patches, nicotine patches, fentanyl patches. These things are going to be topical. And so you just place that in whatever location we've actually placed it. And then that medication, then it gets absorbed through the skin. It still gets into the bloodstream and then goes throughout the entire body. And there are some things that can affect absorption there as well. So if you've got a lot of hair in that spot, or if you've got scars in that spot, then that may interfere with absorption from the skin specifically. And then we've got injection. So things can be injected by IV. So people can get an IV in many of their veins, arm, hand. There are other places that IVs can be started. IM, which is in the muscle. We often will do thigh or buttocks as a muscle. The deltoid, like vaccines, can be used for IM injections. And then we also have sub-Q, which is just underneath the skin. So subcutaneous. And that can be like insulin shots or other shots that are given like in the belly, where you pinch up that skin and give the injection. Or we give some vaccines underneath the arm here in that skin. So IV, which is intravenous in the veins, IM, which is intramuscular in the muscles, or sub-Q, which is underneath the skin, subcutaneous. These things, IV is really quickly and 100% absorbed. So I want to be clear. So anytime you get a medication via IV or by the IV route, then it's 100% absorbed. Whereas like if you're getting something by oral route, there's so much variability. Some medications are only like 10% of it is absorbed. Some medications are up to like 80, 90% of it is absorbed, but it really just depends on the med and other factors. But if you're getting something IV, it is 100% absorbed, which is why when you're really, really sick, or if somebody is really, really sick, an IV medication is often the way that we go in the hospital, because we know that we're going to get the medication in quickly. It will often be out of the body quickly as well, but it's going to get in there and start doing its job, and they're getting 100% of the drug. Things like sub-Q and IM, they are a little slower, but still very useful. Most of the medication is absorbed, not all of it, but still pretty good absorption in those areas, and they're going to work really well also. That is all the routes of administration that can be affected when it comes to absorption. Again, just to go through them, oral, which is the most common. We've got things like stomach acid, food, and things like that can affect absorption. Sublingual or buccal, under the tongue. So still, if you got food or products in your mouth, that can affect absorption. Inhaled, so nasally or oral inhalation. These things are pretty good in terms of absorption as well. But if there are other factors like a lot of mucus or sometimes food as well, that absorption may be affected a little bit. Patches, so transdermal on the skin, through the skin, hairy areas, scar areas, things like that can affect absorption. If you don't have the patch on well enough, that can affect absorption. And then injection, so IV, IM, or sub-Q. And all of those have pretty good absorption, IV being the mostly absorbed, 100% of it, and all the medications getting to where it needs to go. All right. So I just want to talk a little bit more about like these factors that I just kind of mentioned that can affect absorption. So I'll start with food. So I already kind of mentioned that some medications need food in order to be absorbed. That stomach acid, those enzymes that are released when you consume food, the drug thrives off that. So some of our antibiotics are this way. Some medications, that food just helps to slow the absorption so that you don't get this really quick or heavy side effects. So The food may serve a different purpose depending on the medication, but sometimes food is the necessary component to help that medication work better for you. And then other medications require empty stomach, like levothyroxine, which is used for hypothyroidism, or things like alendronate, which is used for osteoporosis. Like those need to be taken on an empty stomach, or they're not going to be absorbed as well. They're already not fully absorbed because they're going through the gut, so you're not getting 100% of the drug at baseline. And then when you add food to it, it's even further reducing the amount of it that's being absorbed because it's pretty much being destroyed or diminished in the gut rather than being able to go through the entire system to get to your bloodstream. Other things, so stomach acid or motility, how quickly you move things through your gut. So sometimes patients are on other medications like over-the-counter proton pump inhibitors, which are things like omeprazole, which reduce the stomach acid. So if you're on one of those, and then you also have a medication that requires stomach acid in order to be absorbed or broken down appropriately, then you've got two drugs that are kind of counteracting each other. So those are things to think about. Other medications may be doing something that's inhibiting or preventing another drug from being absorbed appropriately. And then if you've got like diarrhea for some reason and you're just quickly moving things through the gut for whatever reason, that could affect absorption because you're not giving the drug enough time in the stomach to break down or to do its job. Then we've got different formulations. So most of our medications are like immediate release. When you take them, they start working, almost to their fullest extent pretty quickly. And other medications are extended release, so they slowly work over time. If it's an immediate release medication, it's usually dosed more than one time a day. Versus extended release can usually, slowly give you that medication over a 24-hour period. So you only have to take it once a day. So that's another thing that can affect absorption is just how we formulate the medication. Is it formulated to be absorbed pretty quickly? Or is it formulated like the actual pill or tablet or capsule? Is it formulated to be able to give you med over a period of time? And then I kind of already mentioned drug interactions, but some medications like calcium, even like supplements, calcium and iron, interfere with medications. They bind them up and prevent them from being absorbed into your system. Grapefruit juice, there's that interacts with the enzyme or the chemical that helps to break down or activate a lot of medications. So that can be an issue. So just being cognizant of like, is this food interacting or affecting my medication absorption, or is this other medication affecting my medication absorption? And then finally, something that we call first pass metabolism, which I kind of mentioned earlier. But first pass metabolism means that the drug goes through your gut, through your system, goes through the liver, and most drugs are metabolized or broken down in the liver. And I'll do a whole separate video on metabolism. But most drugs are broken down in the liver, and they may be broken down into their active form, or they may be inactivated in the liver. But either way, they go through that first pass metabolism, and then they're reabsorbed back into the bloodstream. And so after going through all of that, it's like every step of the way, somebody's taking a little chip off. They go through the mouth, through the gut, first pass metabolism, and everybody's taking a little bit from that drug. So the amount that you actually get, it goes from 100% before you take it to 40% by the time you actually are ready to benefit from it. And again, just depends on the medication. So if you're taking it orally, that's why taking the same medication orally that you take as an injection, the oral version may feel weaker or may feel like it's not working as well, or you may need a higher dose orally because it's going through that first pass metabolism. Now I just want to talk about some myths and some mistakes, just some things to think about. So one of the first things one of the common questions I get asked is about generics. So is this generic medication going to work just as well as the branded medication? To an extent. Generic medications have to prove that they are just as efficacious or that they work just as well as the branded product. And so that just means that we know we're going to get a benefit from it, just like we do from the branded product. Like they can't say that this medication is going to treat your pain when really it's not. But there is a range. There are levels to that. So it doesn't have to work at the exact same dose or the exact same absorption rate, but it does have to work within what they call an acceptable range. And so if you find yourself, taking over-the-counter brand name A, and then you decide to switch to the generic of that or the store version of that, then sometimes you may need less or more of a dose. You might find that for yourself, depending on what that is. And that's not always the case. Like some of the generics, the dosing is spot on for people. And it's also very person specific too. So just keep in mind that generics don't always absorb the exact same way as brand medications, but they do have to do so within an acceptable range that shows that you can get benefit without having to overdo it on that medication. The other thing that I wrote here is crushing pills. I get a lot of questions about crushing pills, putting them in tubes or putting them in applesauce. And for some medications, that is absolutely okay to crush them. But for other medications, especially if it's an extended release medication, crushing it can be dangerous. And for those that you can crush, it can be helpful because now you've turned this oral medication that's going to go through the gut into something that can start being absorbed through the buccal mechanism that we talked about earlier. And so that can be really helpful for some medications, but you need to be very cognizant and just asking your pharmacist or your healthcare provider if that specific medication that you're wanting to crush can be crushed safely, because some medications, if you crush them, you just get a burst of all that medicine all at once when really it was meant to be slowly absorbed, or when really we accounted for the fact that you weren't going to 100% absorb it orally. And when you crush it, you get a lot more of it absorbed. And that wasn't the intention of the medication. Some people think that natural medications don't have any absorption issues. I already talked about things like calcium and iron that have the same concerns. This goes for any over-the-counter or any type of supplement at all. They still have the same absorption criteria and things to think about as the medications that are made by whatever manufacturers that are prescription or over-the-counter. And then I really just want to tie this back to my framework, because I've seen this work over and over and over again, that people, when they start to understand how medications are working in their bodies, it just makes you a lot more aware, and it makes you a lot more prone to follow the instructions more closely and more correctly so that the medication can work for you. So in my bridge framework, I talk about each letter stands for something different. The B is building your medication mind map. This is a concept map where you build out all your medications. You think about the dose, the route, the side effects, all of that. What are the things that you need to consider that might affect absorption? Like, should I take this with a fatty meal? Should I take this on an empty stomach? Can I take this medication and drink my Ensure in the morning? And sometimes the answer may be no, because the medication won't work as well. The second thing is to review regularly. So making sure that you are checking in with all your medications, reviewing, have you started anything prescription-wise or over-the-counter-wise since the last time you reviewed? Are those things interfering with absorption or interfering with each other? So just making sure that you review those medications regularly. And then the I is integrate into your lifestyle. So what's your daily routine and how does that affect absorption? Do you work out a lot? And so now your metabolism is kicked up and maybe that's causing you to break down the drug faster. Do you drink a ton of water in the morning? Or do you drink a protein shake in the morning right before or right after you take your medications? Which some of those have calcium type chemicals in them or products in them. And so thinking about all those types of things that may be interfering with your medication. So all of your lifestyle, everything that you do, is this something that needs to be taken in the morning or at night for optimal absorption based on other hormones in your body and their activity throughout the day? So all of those things need to be considered when it comes to integrating and aligning your medications with your actual lifestyle to make them work best for you. So today, just look at one of your medications, or maybe two of them, and think to yourself, how is this medication absorbed? How fully is it absorbed? What are things that are going to help it absorb better? What are things that may make it absorb not as good or not as well? Then how can you modify that or adjust that so that you can get the best fit out of your medications? Also, maybe talk to your clinicians, talk to your pharmacist, drop a comment below if you want to ask a question here, talk to your physicians, nurse practitioners, whomever you see, and just ask them about, are you getting the best out of your medications, especially if you're taking them all in the morning and then just going about your day and not really thinking about whether or not these medications are really getting absorbed. If you feel like you're taking your medications, but your numbers aren't changing, you're doing all the right things, but nothing different is happening, maybe you're not really getting the drug in your system the way that you think you are. So let's explore why that may be, and it could be an absorption issue. So I say all that to say, if you want a simple way to understand your medications, download my medication mind map. I think that will help you start with one medication or two medications today. 5 minutes or less it should take you to take one medication and map it out fully to determine what are all the different aspects that you need to look at for that drug or for that specific medication, and just see it all in one place and start to get a better picture of how these medications are absorbed and how they can best work for you. So if you feel like you need that, if you want to take a stab at just, mapping out your medication, download that free medication mind map guide. It's in the description box below. And until next time, we'll talk about metabolism in the next video, and I'll see you there.